Acute stroke treatment, or the actual treatment of a stroke, is really my passion. And in particularly, after being living in Iowa for a few years, the delivery of stroke treatments for populations that are rural and far away from tertiary centers is an special interest of mine. When a family member had a stroke, it's like an atomic bomb has been deployed in the family. So they are in a very fragile emotional state. There was a revolution in stroke care when this medication called TPA was approved for stroke management, because treatment of a stroke went from being a passive thing to being a very proactive thing. And a stroke is a time-dependent emergency. That means that the sooner the treatment is applied, the better the outcome is going to be. The most gratifying thing is when, these stroke treatments work and we are able to treat a patient rapidly and successfully, and we revert things completely back to normal. When we achieve that, and a person goes back to, and his or her brain goes back to the world to work and to enjoy the family life in the same way there was before the stroke, this is really a very gratifying thing, and patients are extremely grateful because they experienced that disability for minutes or hours, and they knew what they were going to get into, and they're very grateful to be back to normal.